behalf of Region 7 and the Ask for Respect Supplemental Grant, we want to welcome you to our series of interviews focusing on the perils and pearls of lessons learned regarding COVID-19. Our hope is to share the lessons our colleagues have learned and to assist you with your healthcare journey during this pandemic. Thank you for listening.
Hi, my name's Sue, and today we're going to talk with Morgan Shradar, and we're going to talk about hand washing. Now, Morgan, we've been washing our hands since we were children. Tell me why we're going to talk about it now.
So I think it's actually been brought up recently in the news, Sue, that hand washing and proper hand washing, to be more specific, is actually a way to the spread of COVID. You know, when we talk about it, influenza is transmitted sometimes by direct contact, but if we don't take the time to actually do hand washing with all of the proper steps, we're essentially missing the game point here. So why do it if we end up shaking our hands if we're using hand sanitizer to get them dry, or rubbing them on our pants when they're not officially dry, or all of the other random violations of infection control practices when performing appropriate hand hygiene? You know, there's certain avenues that we should always do. Take the 20 seconds, sing happy birthday twice, make sure you're making those touch points on all of the steps. And so it's a great opportunity today to just spend, just a few minutes to go over the whys of it.
Okay, so there is a proper way to wash your hands. Can you just show us an example of that?
Right. So one consideration is that we all love jewelry, right? Women love jewelry, men like jewelry as well, but jewelry can actually impact reaching all of the surfaces of on your hands. So if you have a ring on, and let's say you work in the healthcare profession and you have a badge that you're using, see if you can get one of those adjustable rings, and you can actually just slide your rings onto your badge for the day. And that way they're removed from your hands and you have adequate surface time that you're going to be able to get all of those surfaces. Plus, if you wash your hands all the time and you are wearing rings, you can't validate that you've touched all the surfaces, and then you can't also validate that you've dried underneath your rings. So you could potentially be harboring bacteria underneath the ring, and it can cause skin breakdown or outside infections.
What would you say is the most common mistake made when we wash our hands? Where do we miss spots?
Right. So I think that we forget about our fingertips, literally the tip of your fingers, because if we are not taking all of the steps in, you think about that you do all of this notion, but do you actually spend the time to touch your fingers onto the solution that's on your palm of your hand? And the other area is the outside area of your palms. If you don't actually do all of the steps on the gripping and all of the proper steps, so we'll go through that. Sue, I think we should just go through it right now. So
let's do that.
Using hand sanitizer, 60%. If you cannot wash your hands with standard soap and water, grab a 60% alcohol-based hand sanitizer or greater. Minimum is 60, greater is okay as well. So you put the appropriate amount of hand sanitizer into your hands, and then you begin by rubbing palm to palm, okay? After you rub palm to palm, then you're going to spread out your fingers and get into these grooves using the top side of your palm, and your thumb is actually running down the side of your hand by your pinky finger. So getting into this space as well, both hands, inverting those hands. And then we're actually going to do this. Locking our fingers, we see this all the time, but you're going to lock your fingers and rub, making sure that you're coming into contact with all those surfaces. So if you think about it, we've hit the back side, we've hit the front side, we've interlocked our fingers, we've touched all those surfaces, including the outside area of your palm, all right? Then you're gonna cup your hands like so and move them side to side, really getting all of those contact surfaces in there and all of the grooves on the inside of your palm space, okay? Then you're gonna grab your thumb area, this tissue part of your thumb as well, and get a solid circular movement right here, moving to this hand as well. And then this is the part that's sometimes forgotten. Your fingertips into your palm, taking all 5 of your fingertips, making them into a little C and getting into that palm space right there, right? Making sure that we have all of that done. And then if you have solution remaining, going like so, and then I always touch my upper or the lower half of my wrist right here. Sometimes, if depending on the gloves that you're wearing, especially in healthcare, they kind of bunch right here, and so I always try to tackle a little bit on my lower half of my wrists. So that is the proper steps of hand hygiene. And you'll notice it took longer than 20 seconds, a little bit because we were explaining it, but also if it takes a little bit longer, there's nothing wrong with that. But the minimum amount is 20 seconds.
It's really interesting because we wash our hands all the time, but do we wash them as thoroughly as we should? How many times a day do you suppose you wash your hands, Morgan?
So anytime that you're coming into contact with a patient, you want to wash your hands, or you're changing actually what you're doing. So it's not just patient care related, Sue. So if you go to the grocery store, you apply hand hygiene when you get out of the car, you grab a cart, you go grocery shopping, you get back into the car, hand hygiene can be applied again in that place because you're changing what you're doing. There's a movement change. You're coming into contact with something new. So before you touch your steering wheel, apply hand hygiene, put a little bottle in your car, apply hand hygiene, because if you're putting on your sunglasses as you're driving, you want to make sure that you have clean hands before you come at your face. Or if you're thinking about it and you're like, man, this hair is in my face, I can actually move that away, and then I have clean hands and fingertips while I'm doing that. So you're limiting potential spread of viruses and bacteria from different places just by performing proper hand hygiene.
You mentioned hand sanitizer. What about soaps? Do we need to have an antibacterial soap for washing to be effective? What's your recommendation on that?
So I actually Googled that question, and CDC has some pretty decent guidance out there saying that there is no additional value in using antibacterial soap. Soap and water, plain soap and water is fine. It doesn't even have to be hot water. It can be just cold water. It's the process of going through all the mechanics of it, because soap has the ability to break down elements of burden that are on your hands, just standard soap.
Super. That's great to know. One last question. I know women like to wear the nail polish, the shellac, artificial nails. What's your recommendation on that?
So I love all the designs that happen with well-manicured nails. The shellac looks nice, the tips look nice, and things like that. But the most important thing is to make sure that it's well-maintained. Once that starts to break down and your fingernails are growing out and the shellac is starting to peel at the base of it, you really have to be very diligent in getting that off your nails as quickly as possible, or having it redone at the local nail salons, because anytime that it starts to peel up off your nail, bacteria can harbor in there, and there's really no great way to get that space cleaned. And so you want to make sure that your nails are always maintained cleaned. Even if you don't have polished nails, having really long nails, you need to get underneath those nails. Some people have elegantly long nails. I do not. But making sure that you get underneath those nails with using your hand motions and things like that in areas like this motion, that way it'll get up underneath those.
Super. Thank you for all you do, your expertise. Any last thoughts?
Really take the time to do hand hygiene. I can't, so soap and water is a great avenue, but hand sanitizer at this point does serve a purpose. So encourage people, if they're not doing proper hand hygiene, or you see somebody, take the time to educate them. It will really help stop the spread of the current virus that we're battling, but also just promote health overall.
Thank you, Morgan. I appreciate it. Thank you for listening. Take care, stay well, and wash your hands.